You need to be of the mindset that you're going to be the CEO of your own professional enterprise. And if you take on that mindset, then all of a sudden now things outside of being a good practitioner, being really good at your clinical work, take a whole different dimension. And I think that the world has changed a lot, and we're being asked to do a lot of different things we never knew and we were never educated on.
It's a pleasure to meet you and wonderful to have you part of the team. This is great.
Yeah, nice to see you too. But where are you calling in from?
I work in New York City. I'm at a
Uh-huh.
cancer center here, Memorial Sloan Kettering Cancer
Oh,
Center.
MSK. Okay.
Yeah, and
I trained at HSS.
I know the pain teams there pretty well, and
Yeah.
I work with them. I run the fellowship, so we're still rotate through HSS. So,
Okay. All right.
and where do you work right now?
So I was at Geisinger for 15
Oh, okay.
years. I stepped away from there about almost a year ago now, and I've been doing a number of, things that I've wanted to do over the last 3 decades. So I've taken a
Oh,
little
okay.
time off.
Nice. Well,
Yeah.
I hope it's very rewarding. I can't wait for
Uh,
the day when I get time off like that.
Listen, sometimes you just got to bite the bullet and do it, man. And I tell you, the best thing about what I'm doing now is not, I mean, I was, pretty high level, C-level executive, things like that. I was really burnt out, I think, from a lot of that stuff. But I miss, there's certain things I miss. I miss the residents, I miss certain things like that. But getting up on your own schedule is a very different experience.
Yes, yes. I hope to have that one day.
You will, you will. So I'm an fellowship trained, board certified orthopedic trauma surgeon. I came from a number of different places, trained in Chicago. I'm also an attorney. I have a master's in public health and a master's in business administration. And I've been involved in really almost every chair or sat in almost every chair that you can think of in medicine, whether it's, academics, whether it's in leadership in the corporate suite, whether it's on an entrepreneurial endeavor or a number of different leadership boards. A past chair of the American Medical Association and current trustee of their board. I'm also the chair of the Joint Commission, and I serve as a member of the board of directors for AO North America and a number of different organizations like the American College of Lifestyle Medicine. So I sit on a number of boards from governance and leadership. I've been a professor of orthopedics, have over 100 publications, peer-reviewed publications. And I think, as I said, I think from my perspective, I've had really a good opportunity to sit across the entire health ecosystem from care from the front line of delivering care to advocating for healthcare policy to teaching residents and doing research and writing papers, and ultimately now in the world of entrepreneurship to try to re-empower physicians to gain back agency and autonomy as the world has changed. Hey, Krish.
And
Yeah.
any,
How are you? I think I saw your webinar with Lee briefly,
Oh,
so finally getting to meet the legend that we've all heard. So amazing, and I'm really excited that you're going to be a part of our program.
listen,
So
I'm
thank you so
I'm
much for
really
dedicating
excited.
time.
Yeah, I want to congratulate the two of you for doing that. I mean, this is, it's so needed, and I know you guys have done it in other specialties, but it's so needed, and it's the number one thing that everybody asks for as they're transitioning. And what the work we're doing on MDEnvoy, I think fits really nicely in it, right? It brings the action arm to a lot of the education if people want it.
but I will say I think all of us, all four of us, and also the whole team at IEP we all believe that as we want to provide better medical care as individuals, physicians, we've got to be better at the business aspect of things. I'm learning that in my own hospital system.
Sure.
Is there any kind of like, because you've worn so many hats, how does someone start this besides obviously going to our conference? Like, how does someone even approach this idea of what kind of things do I get better at? Because I think at the stage when you're graduating residency, they're trying to make sure they can mend a bone still.
It's a great question, and I've actually sat with this for a long time, but more recently, I think in kind of in a real earnest way. And if I think all of us, as we look back to when we finished our residencies and fellowship, we came out, I think, with a notion that we were going to really focus and be the best clinicians that we could be. Our training led us that way. I think the way we're, transitioning even through school into residency, we're all focused on trying to be the best clinician and the best provider of care to our individual patients. And the one thing that I think my mindset has changed, and if I was going to talk to people coming out or in the transition from fellowship to practice, is underscored by what you talk about in terms of this desire, this gigantic need that people, argue for and ask for. And that's the business of medicine education. And I think that speaks to a simple mindset transition that I would encourage people to go through. And it's not just when you graduate fellowship to be the best practitioner of medicine. But in fact, I've articulated this a couple times, is that I think when you graduate and you're ready to enter practice, you need to be of the mindset that you're going to be the CEO of your own professional enterprise. And if you take on that mindset, then all of a sudden now things outside of being a good practitioner, being really good at your clinical work, take a whole different dimension. And that's, I think, applicable whether you're in private practice or academics or even employed by a system, because your career, which the clinical portion of is just a part, is your most valuable asset. And I think that leads you to learn and be educated on things like contracts negotiation, finance, leadership, branding, etc., that are all aspects of becoming a operating system of your own professional enterprise. I think clinical excellence gets you inside and gets you in the game, but I think business knowledge determines how much control you have ultimately over your future. And so that, I think, when you think about a change in mindset, that's the one thing that I would want to impress upon people to avoid maybe some of the mistakes that I made, is that we all believe that when we finish, that the better doctor you are, it's supposed to lead to the greater success that you'll have. And I think that the world has changed a lot, and we're being asked to do a lot of different things we never knew and we were never educated on.
Lately, there's this new trend that's going on in the Silicon Valley about the four burner theory. Have you heard of this thing where
Yeah.
essentially there's like the concept of family, friends, work, and I think there's one more. One of the things that's really unique on the MD Life Summit is we're running kind of a work-life balance workshop. Do you think
Uh-huh.
that there is something to say that for someone who's a real high achiever can be done where you're managing all of the different aspects of family, your interpersonal relationships, your work relationships?
It's really interesting. I think that this four burner theory is pretty interesting. I've also been kind of watching it, and some of it rings true, right? So it's the four burners are your family, your friends, your health, and your work, right? Those are the
Right.
four. And they say that to be successful, one has to be turned off. You can only really be successful at three. So if you're good at family, friends, and health, then your work will suffer. Or if you're really great at work and your friends and your health, then your family suffers. And I think for most of us, that probably rings true, but it's not uniform. I think it's episodic, right?
Mhm.
And I think if you accept this as an episodic type of description or a descriptor of what can happen, then I think work-life balance takes on a very different perspective because we tend to paint with a very broad brush, achieve work-life balance. And what that means is if you've got the four burner theory, then you're saying, I want all four burners to burn at low, right?
Yeah.
That's how I'm going to achieve work-life balance. I'm just going with your analogy. I haven't really talked about this with anyone else. But if I want to turn one on high, then one's got to shut down or go lower. So the question
Yeah.
is can you go high on all four burners, right? And still achieve some level of work-life balance. And I think the only way you can do that is if you approach it from an episodic perspective. Absolutely. I can wake up tomorrow and I can burn all four. I can go straight on all four. I'm up for 24 hours, right? My eyes are blurry. I get home on the red eye just to make sure I can see my family. But this is what we do, right? And I can't sustain
Yeah.
that over 365. So the only criticism I have to that theory is that it tends to, like so many things, push us toward this kind of steady state where everything stays low. And I'm not that kind of person. I think the highest achievers in society are not that kind of people, right?
Mhm.
And I think that what it does is it tends to mentally discourage you from those moments of brilliance that we all need to have. So orthopedic trauma, yeah, absolutely. During our residency, I'm working 110-hour weeks, right? But I'm not doing it
Yeah.
for 52 weeks in a row. I may do it for 1 week just so I can have the next weekend off, right? So sometimes you've got to do those things. And so I think it's a great perspective to put kind of those four buckets together and be mindful of them. But again, the only contrary thing I would say is it's great to know those buckets, but I also know I can burn all four for a period of time and still achieve great success.
But I will say in conversation with some of the younger physicians, even regarding to this conference, I don't think many of us actually want to be CEO. maybe not all of us want to burn a lot,
Yeah.
but there's still some value in some of the things we're teaching. What if you had to focus on one aspect, either with our summit or in general, where a lot of us may not want to be a CEO, but still may need to learn some of these things. What can someone like that, or someone more of the general population of physicians come to learn? What should they be seeking out? Because obviously not everyone wanted to be a CEO. If that
Yeah.
was the case, we'd have no one working.
Yeah, I think that, when you look at this notion of being a CEO of your own professional enterprise, right? It's not necessarily to say that you put on a three-piece suit and a tie every day and you come home and you manage your thing. It's really the perspective that you carry a portfolio of things that are important to you. Now, each will have a different level of importance. But when you're a CEO of any enterprise, you are making sure for example, your profit and loss statement works, right? So that has to do with personal wealth and investments, more making smart decisions, doing the right tax strategy and things like that, none of which are taught in medical school, right? And that's the purpose of conferences like this. The other aspects of it are, investments in things that'll make you happy outside of clinical medicine. Right. So I run into people who are entrepreneurial, forward thinking, and I find them to be really successful. And then always conversation leads to some sort of, deep dream that they have that they never articulated. Right. I can't tell you how many entrepreneurial, really forward thinking physicians I've met that have a book that they've already written in their head. I bet you two already have one. Right. And I'm saying, so how do you extract that desire to get to the next level? What do you sacrifice to get there? What makes it easier? In the world of procedural, you guys may fall into this too, but in, my world of orthopedics and neurosurgery and spine and all these people who are proceduralists, I can tell you probably 80% of the surgeons that I've spoken to in those spaces have told me that they have an invention that they know will make life easier. I'm not talking about one or two, I'm talking about almost everybody. Then I asked the next question. I said, well, how many of you guys have taken it to market? And they say none. So when I talk about this concept of being a CEO of your own enterprise, it's making sure these buckets are there, but at the same time building a team around you that can help you fulfill these things that will make you whole. That's the concept around MDEnvoy, and the idea of that is how do we then take somebody who's got all this passion and ideas that they just don't have enough time for, right? And how do you create opportunity and more time? So for me, again, having been in the clinical world, the academic world, and the leadership world, et cetera, I've had all these ideas for decades. And it wasn't until, as Ahmed and I were just talking, it wasn't until I had the courage to step away that now all of these things are starting. Now it's scary and all those things, but at the same time, if with the right people around you, you can achieve amazing things. Physicians, as a cohort of people, are just amazing people to go into the practice of medicine. But as you go further into who are these people, there are an incredible layer of people who are just so incredibly entrepreneurial and innovative and out of the box thinking, right? That kind of sit at the top of the physician layer, but very few of them break out and actually do something incredible. These are my personal musings, but I watch carefully what's happening in the world of social media, right? And one might argue that there are social media influencers that are probably more impactful or influential in the public's mind than even some of the most hardcore academics that we would say are
Yeah.
the thought leaders in medicine, right? Most people are getting a lot of advice from people who speak well on a blog or, get onto social media and have a strong opinion about something. And that to me is, interesting. I think it needs to be watched very carefully. It's like people are rising to this desire to have influence outside of our traditional sense. You had to write this many papers. You had to get on podium and you had to be invited to your specialty meeting. And that's how you built your credentials and people would seek you out. Today, man, listen, you can be somebody working in Paducah, Kentucky, that just happens to have a big following of people when you talk about the next GLP or protein, right? And that's changed the game completely for us today. And I think we're going to watch that very carefully. But at the same time, we got to recognize that that's what our future is. We're not going back, right? We're not going back in any way, shape, or form to having credentials and papers be the only source of credibility. So to your point, I
So
think those,
can I piggyback on that?
sure.
So I was going to piggyback on that. This is where kind of with Amit and I are doing these, we deal with fellows all the time. Maybe 10, 15 years ago, the urgency to understand how to manage all of the other parts are less relevant. But today, with where all the cuts are and how hard it is to maintain a practice, it's almost like if it's not in the medical school curriculum or residency curriculum, I mean, you feel that urgency, right? I mean, I think
Oh,
you're
totally.
sensing that it's not no longer a benefit or yeah, it's an added thing. It's almost like a must know to
Yeah.
really operate in today's medical climate.
Yeah, I think your time frame is right. If you go back 10, 15, maybe 20 years, and I'll give you some statistics that are very interesting. So in 2018, 2019, it was a very important year because that was the year that half of the physician population, we just passed that half of the physician population became employed. Prior to that, less than half of the doctors were in independent practice or doing their own thing. In just the 7 or 8 years since that transition, we're now at 75% of physicians who are employed. I'll give you some other interesting statistics, and some of this I think needs to be validated. But I heard anecdotally that when you look at the future workforce, we're looking at, and this is documented, something like 86,000 physicians short by 2036. Now, that's a statistic that's important to remember. That speaks to our pipeline. Are we training enough physicians and things like that? The demographics show that we're in big trouble because the boomers are getting older, the complexity is getting more, we're getting fewer and fewer doctors, and we've got lots more in the world of scope creep that people talk about. So people talk about a nurse practitioner with AI or an AP with AI is going to be better than a doctor without AI, right? Okay, these are the broad statements. The other interesting statistic, and I'm going to wrap these all together, is there has been one anecdotal story, and I have to validate this, but that was shared with me that 50%, less than 50% of doctors who are in medical school today training have intention to practice full time. Let that sit with you for a second. Right now, you've got a workforce that is short, complex, aging population with increasing complexity of disease, right? A pipeline that's small, and then those in the pipeline, less than half want to practice medicine full time. Why is this happening? This is happening, in my opinion, because the circumstances of practice have changed. When you become a physician, if you become an employed physician and they tell you you got to see 20 patients a day and here's the criteria, and if you don't hit it, you get a dashboard and you get dinged over the head, right? And you sit there and you say, well, this patient doesn't fit. I have to do prior auth on this one. I have to do that one because, at the end of the day, you're basically telling me that I have a job. Well, a job is not what a lot of us went into, right, to be doctors. If you take away our autonomy, our decision making, our clinical authority, and all of those things, then it becomes I'm a regular worker. So the next thing that happens, right, and these are all phenomena that are linked together, I think, in my opinion, is when workers get oppressed, right? What do? Just look at history. If you're working in a sausage
Yeah.
factory, right? And you're getting oppressed. You sit there and you look at your buddy and you say, hey, are you oppressed? And he says, yeah, I'm oppressed. Well, let's do something together. Now you see the rise of collective bargaining and unionization, which is on a rocket ship. Why is this all happening? It's all happening because the world is turned upside down. And the idea and the desire to be a doctor is less because our notion of what is less autonomy. So doctors are now looking for all of these side hustles. Look at the rise of the social media side hustle. I see two things on my social media. One is how bad medicine is. Everyone complaining this sucks and I can't do anything. And the other side is I can make it better for you. You can make extra money, buy my book, right? Those are the two
Yeah.
sources of feeds that I get in medicine today, right? And so I look at all of those things and it feeds into kind of my knowledge base or understanding. But to your question, and I'm sorry for the long answer to your question, is at the end of the day, the circumstances have changed enough. And those who actually want to practice medicine, it's absolutely critical today, more so today than it was 15 years ago, that you have control and you take the CEO mindset and you have to understand how to break away because that's the only way you're going to keep maintain your autonomy. So educational courses, I think the company that I started with, Lee, I think are going to be critical. People need help at the same time,
Yeah.
right? And that's why I think the rise of the physician agency is we're just beginning.
You're right. We have to teach the physicians that they need help too.
Yeah.
We're so used to helping others, we probably don't realize how much help we need in ourselves. I think that's probably
Oh,
one of the lessons I've learned.
culturally, doctors are known really for two things. One is, and it's good and bad. It's number one, we graduate, we think we know everything, right? Doctors are
Yeah.
notoriously smart. We've achieved a lot. We've worked really hard. And you leave and you say, I pretty much can do anything. And the second problem is we never ask for help, right? No doctor turns around and says, hey, I don't feel like I know enough about this and admits it to their buddy, right? It's usually the conversations are always like, hey, have you experienced this too? Yeah, me too. Good. I'm glad we're in the same boat. So those are the cultural phenomena that throw, everything into this gigantic morass. And I think picking and choosing how we get ourselves out of that is really the I think is our physician battle over the next decade. I'd say 5 years, but I'm going to say decade.
No,
I love
that's our
this.
goal. We're
I
trying
feel
to
like
tackle this ourselves. That's good.
Yeah.
I feel like we could have an entire symposium with just the three of us asking questions of Michael, right, Eddie? There's
Yeah.
so many pearls of wisdom. I love it.
I think you guys recognize that I spend my career kind of in this intersection and a lot of different things and the advocacy and understanding physicians. And I'm telling you that, the current avenues that we have through organized medicine and things of which I truly believe, these are ways we're going to fix policy and Medicare reimbursement and hopefully make it easier for physicians to get paid. But very few in today's economy and workforce. And Eddie, I look to you because I think you're on this generation. You don't have the patience for a 10-year fix on a federal solution that's going to give you 20% of what you want, right? We get a slight bump in Medicare payments. Maybe your lights stay on another 10 days. It doesn't feel like a win, right? When there's that much compromise on something that we've already compromised so much on. So I think this opportunity for us to empower ourselves, I think the time is right.
Well, we're glad you're part of the team.
Oh, happy to be here.
We really are so fortunate.
Yeah. Well, I can't wait. I was at a meeting with Dana Jacoby or Jacoby. She's great,
She is.
right?
She's
And
great.
yeah,
Yeah.
she's got a really good viewpoint on kind of the larger ecosystem of private equity. But we were almost a tag team, conference. I followed her, but she was like, and Suk's going to tell you, when you're ready, who's going to help you, right?
No, it
Kind
really
of
does
thing.
take a village, all these different pieces,
Yeah,
everybody needs to lean on. So it'll be
yeah.
amazing. Yeah.
But we've built quite an incredible faculty lineup. I almost was telling Amit, like, I would never say this, but I'm getting wonderful advice from all of you guys in the process. And they're like, we're
I don't
literally
even
like,
want to. I don't want to
hey,
moderate
when do you
this. I
got
want to
free
learn.
time? Yeah, the moderators have got the best role in the thing
Well,
because
I tell
we're
you,
learning so much. I mean,
I tell
it's
you, because
incredible.
part of the reason I enjoy doing some of this is because honestly, right, I learn as much as anyone else, right? There is
Yeah.
always something. My father actually told me this. He's an orthopedic surgeon. I'm a third generation orthopod. My grandfather was an orthopod. I asked my dad, we used to go to these conferences. He'd take you on vacation because there was a conference. This was the good old days, right? And I'd be like, why do you attend these things, right? Or why do you attend that thing that has nothing to do with you? And he's like, I go because I always learn something, right? I always walk away with some additive knowledge that will impact something that has maybe nothing to do with what's in front of me, right? And I think that's kind of how I approached, my training and education is like, yeah, why not? I want to study something because I know it's going to help me be a better doctor.